What are three of the most common concussion symptoms that you'll see in females? Number one, just due to biomechanics, you're going to see changes in neck strength and stability. So it is more common for females to have whiplash, concussion injuries. And that's something that has to be addressed with recovery, and also prevention is neck strength. Number two, clinically what I've seen is females are more likely to have changes in their vestibulo-ocular reflex after concussion. Some of the more recent research shows that there's going to be changes in the vestibular system. And I do see that females seem to be more likely to kick crystals loose in their inner ear after TBI. So basically you whiplash your neck, you hit your head, crystals become dislodged. They go into areas of the inner ear where they're not supposed to be. And now you're dealing with what's called positional vertigo. And we need to make sure that we assess that. Hi, I'm Dr. Jeremy Schmoe, founder of the Functional Neurology Center in Minnetonka, Minnesota. We work with patients with unresolved post-concussion symptoms and other complex neurological issues. Our approach to complicated neurological issues is very different from other clinics. We use the latest technologies and a combination of functional neurology, functional medicine, and chiropractic care to get to the root cause of what is causing your problems. With this approach, we're able to get you back to optimum function and get you doing the things that you love to do. What are three of the most common concussion symptoms that you'll see in females? Number one, look really in depth with the cervical spine in females. We have a technology that we use called neck care, where we can actually get all the range of motion data, joint position error, where basically if I'm looking at you, you're going to close your eyes, turn your head, come back and land right on the target. We're going to get data on all of that, as well as do what's called a butterfly test, where there's a target that's moving on the screen, and then you got to move your head and eyes together to make sure that we're not missing anything with the neck. Because your neck might feel fine, but neurologically, it might not be connected to your brain the way that it needs to. So we really need to look at that and also look at the ligamentous structure in females to make sure that you didn't develop what's called craniocervical instability. So basically instability in the neck, and then that's leading to issues with how you're actually getting blood flow up to the brain. So we got to look at the neck. We got to really deep dive the vestibular. And number three, they've shown in the research that depending on when females get concussion in their cycle, that can actually lead to changes in their recovery. And that has to do with levels of estrogen and progesterone at different phases of your menstrual cycle. So we do need to take that into account and also consider looking at hormones. With the brain, the way that the force enters in, you can actually concuss your hypothalamic pituitary adrenal axis. So the way that your hormonal system is regulated. So we definitely need to look at that with female concussion and take all of that into account.
There is hope. There are answers. Click the link you see with this video to schedule a consultation with my office today.